Today we're going to talk about healthcare and AI and the effects that AI is having in the healthcare industry.
Which is why Josh has yet another abstract art background.
And we have a special guest today, someone I've known for almost the past decade, Dr. McMahon. It's great to have you here. I think we share a passion, which is, healthcare in general is about helping people. And if we can use technology to help more people, or if we can figure out how AI can do that, or if it's a telederm app or whatever it may be, I think that's pretty exciting for us, for all of us. Dr. McMahon, real briefly about you, board certified pediatric dermatologist, associate professor of pediatrics and dermatology at Cooper University. I believe you're a pioneer in pediatric digital health. You've developed that telederm app, and you've worked at Children's Hospital of Philadelphia. You've kind of been around a long time and know the technology space. Great to have you here today. Very excited to discuss AI with you. Tell us a little bit about yourself and what excites you about AI.
Yeah, thanks for having me. It's wonderful to be invited, and I have been around, I guess, a long time now, I can say, because I remember doctoring when we had paper charts. So that's a long time ago. It's kind of crazy in a podcast like this to even imagine writing by hand, but yeah, that's what we used to do in 2005, and we've come a long way. So I am a full-time pediatric dermatologist. I work both in a private practice setting and at Cooper University in an academic setting. So I work with trainees, medical students, and I see patients that are 25 years old and under with all sorts of skin conditions. I'm excited to talk about AI, and I feel like it's not the if we use AI, it's kind of how and when. And so, yeah, thanks for having me.
I half expected Josh to go, while you're here, Doc, could you take a look at... No,
Done that already.
Right.
Which is actually, to me, the first thing I think of when I think of AI in healthcare is access, is patient experience and scheduling. And is that something that's top of mind for you?
Yeah, definitely. Patient scheduling. I mean, we've come a long way in general. It used to be the old school, make a phone call, wait on hold. Now we do have automated scheduling. AI can augment that by having it be triaged better, right? So right now we expect the person on the other end of the phone to hear the parent, in this case, asking for an appointment. They're trying to gauge how urgent it is. That can be difficult depending on the level of training of the person who's scheduling. We try to give them criteria. Of course, they're human and they're going to make mistakes. So having an AI triage bot, hear that or see that the patient is 3 weeks old, has a lesion on the face. I mean, that's just going to automatically generate an urgent visit. So there are things that we can do that we don't have to retrain AI to do, and do it better and better as we go along. So triaging, the patient scheduling is a huge part of, I think, how we're going to start using this more readily.
How does that affect kind of like the hybrid workforce, right? You talk about all the people that work in your offices or work in the hospitals. Now, scheduling is kind of being used, let's call it virtual agents are kind of doing a lot of the scheduling nowadays, or even the cancellations or rescheduling. What does that look like from a person perspective, a people perspective? How are the employees feeling?
I think they're feeling fine about it. That's not necessarily like the part of their job that gave them the hugest, gratification anyhow. So there is usually, upset parents when they hear it's going to be 6 months, et cetera. So there's a lot less of that interface. Of course, we're still going to want to have the conversations when we need to, but that doesn't have to be there minute to minute when, especially since I have scenarios now where, I mean, my schedule is booked, and if a patient is scheduled and they cancel, that spot is then offered automatically to a handful of patients who are on a waiting list. They can grab the spot, and there's no human interaction needed. It's just like when you make a reservation at a restaurant. I mean, you're on a waiting list. It generates this, if you want it, grab it now, first come, first serve, and patients love that experience. They don't need to talk to a human for those kinds of interactions.
Would you say that the kind of patient access and engagement use cases are kind of the primary or the initial AI use cases that have been adopted in healthcare, or where else is the healthcare space adopting AI?
It's both, right? So patient facing, I think I can categorize them into scheduling, inbox automated responses as well. So they send the doctor a message. It's really being screened. In some scenarios, not yet in our office, but I know in some major academic institutions, they're implementing auto responses. This is a question about a refill. Let's first send them this information that might nudge them towards clicking a button to request a refill instead of using this portal. So there's ways to minimize the inbox, which is a huge part of the burnout for the physicians and nurses. So it's triaging those patients for scheduling. It's triaging the inbox messages. And then from a patient-facing kind of futuristic interaction, I can imagine a space where the telehealth encounter is taking in their image, generating a few potential diagnoses, and then either spitting back some information to the patient or sending that through to the provider to have kind of like a top 5 list of potential diagnoses. So sort of streamlining a telehealth experience. And then there's the whole other conversation surrounding how it's going to hopefully be provider facing. And that's going to be from the actual, point of care patient experience when we're utilizing it with scribes. It might be enhancing our ability to teach in the medical school. There's kind of a bunch of use cases that I'm happy to talk through.
Now, you talked about earlier about the paper-based, right? Back in the day. And you always had that undercurrent of, is there concern about compliance and data privacy, right?
Yeah.
And, there are always the scary stories about an office closing and losing their paperwork, whatever. And obviously we see in the news where there's big data breaches. Is that a big concern when you're looking at these platforms and these use cases?
I think at this point, now that we've adopted electronic medical records and we are aware of the fact that there could be data breaches, cyber attacks, et cetera. I mean, it's the way of the world. I don't think any of us are naive enough to think that we're going to somehow be able to practice without the internet and the, digital interfaces. So AI is an extension of that. Of course, we're going to want to adopt HIPAA compliant platforms. And that's kind of the best we're going to be able to do, right? We're going to have to trust that it's as compliant as any medical record will be. There was a conference that I just went to, and one of the lectures talked about AI, and there are non-HIPAA compliant interfaces. We just have to be careful not to try them out, and also, by the way, accidentally include patient information. That would be a no-no. We just have to be smart about which platforms we're using.
So, I mean, Dr. McMahon, we're the real heart of, dermatology is if I could walk in and have a diagnosis done by someone analyzing. I mean, we talk about image recognition and AI vision, right? So even with the new ChatGPT models, you're able to upload an image and say, hey, diagnose this for me, or what should I do for this, or things of that nature. And we're seeing extremely high rates of intelligence and accuracy, even in detecting cancer in images. The AI being able to do this almost better than a human eye could do, or most human eyes. Let's call it most human eyes. I'm sure there's plenty that could do it better, but most human eyes or they easily trained. So from your perspective, right, dermatology is a pretty important touch and see kind of practice.
Yeah.
Right. How important is AI from a diagnostic perspective going to impact the industry?
Yeah, I can see it being huge, and I can walk you through kind of the patient experience and how this could be utilized in multiple different time points. So say you're a patient, you have an abnormal mole would be the most, the simplest use case. And you go to your primary care doctor. The primary care doctor is not a dermatologist, but they're going to want to try to help determine, is this something that should be seen by a dermatologist or not? With their eye, they're going to be only as good as their training has allowed them to be as a physician. If they were to utilize something like AI, which has the ability to take a good picture, if there's adapters that you can put onto your smartphones now, and it's such a crystal clear picture that the AI bot with the brain of a dermatologist, let's say, can say, yes, this is high risk and it's graded, 0 to 100, whatever. They're going to be better at referring patients. They're not maybe taking them all off, right? That's not what their training has taught them to do, but they're going to be better at referring the right patients to us. When they get to see us, whether it's a physician assistant or a dermatologist who's been in training for 40 years, we can utilize the same type of tool to help us determine, are we going to strongly recommend a biopsy or not? Because this is going to go into the brain of that bot and say, yeah, it really resembles a melanoma. So this could be you're in your first day of being a dermatologist, or your 700th day, and it's going to make you at least a little bit better than you probably would have been on your own. And then when you get to the point of you're biopsying it and sending it off to the pathologist, they're going to potentially do stains and need to count up the number of positive cells that are staining positive for melanoma. That can be really tedious, and a computer is better at doing that. So every stage of the way, when you're trying to, tease out who has a melanoma and who doesn't, the AI is going to make us better, I think, at doing that ultimately.
Yeah. I mean, that's what I was envisioning as well, as kind of that whole pipeline of,
Mhm.
because no one just calls up a dermatologist and say, hey, I have a pimple or something like that, right? Usually they go to their, general practice, and then, they get referred and something happens along those lines. And I think AI can fit into that pipeline a lot. But I
Mhm.
think I'm going to change up the podcast a little bit here if we can, because I think I have an idea. I am going to share my screen and I'm going to prompt ChatGPT with something, and let's see if you kind of agree, or like how close are these generative models even coming to what a general doctor would say, a regular or a dermatologist, or things of that nature. So I got ChatGPT 4.0 up here. Now, if I were to upload an image, and I have this picture that I got from Google with some acne on a kid's face here, and I say something simple like, you're a pediatric dermatologist, please diagnose this image. Let's see. Super fast, by the way, as you can see here.
I feel like it's usually faster. Did you click the actual button?
Yeah, it's doing something here.
It
Oh,
is usually a little faster.
it's going through residency and fellowship. And
No, hold
Really,
on. I'll get
really
back to you
4
in
years
12
ago.
years. Yeah.
All right, here we go. So it just read a whole dermatology, textbook, and now it's giving me an answer. So I don't really know what this stuff means. But image shows a close-up of a lower face adolescent male with multiple red inflamed pimples. Some other words I don't know.
Yep.
Consistent with this. Recommendations. Is
Yep.
this something you would trust?
Yeah, well, here's the thing. Like, yes, trust and verify. I mean, one of the things it's recommending here is hormonal contraceptive for a male patient. So that's like, you're never going to do that. But otherwise, yeah, if that was a female, that would be a very realistic medication, right? So it's tweakable. And this is basically just saying, here are the general recommendations. It's not diving too deep. If you ask it more questions, it probably would. If you said, "Hey, this is a male patient. Do you really want to give it oral contraceptives?" It'd say no. But
I mean,
it's
so this is what
part of
everybody has
practice.
access to right now.
Yeah.
And I would assume lots of people are using it for this, right? Before going to their doctor, or before going to a dermatologist, or waiting 6 months, for example.
Yeah.
What would you advise to those patients doing that?
I think that for things like acne, like certain rashes in kids, molluscum is a really common infection we see that's really not dangerous. If they can be reassured that that's what it is, some people just want to come in to have me say, it is this, it's nothing more exotic, it's going to go away on its own. Yes, it's poison ivy. You can put some cortisone on it. I mean, that's a lot of what I do. I love doing that because it's easy and it's fun, and then I get to talk about their soccer practice, but that's not really like utilizing me to the max capacity of my brain, right? So there can be a lot of reassurance provided, a lot of over-the-counter options, and then a lot of, oh yeah, this looks like it's scarring. Maybe you should make that appointment, right? So they probably should have said in that case, that's pretty severe, acne. You probably should also get to see a dermatologist so that you don't wind up with scarring. So I think it can be a huge guide along the way.
It's an interesting question because you're speaking about, to Josh's point, reliability and trust issues, right, with AI decision making or diagnosis in this case. And would the concern be that you'd get a lot of people that are, quite frankly, hypochondriacal, where it's like, oh my goodness, I think I now have this, and this, because they get these sort of ranges of diagnosis from an AI.
That can happen. So, for instance, like psoriasis, if it's in a certain pattern, might look like syphilis, and that's going to freak people out and maybe, even generate some marital conflicts in certain scenarios. But so you can imagine that it could be a slippery slope of knowing too much. But most of the time, I think it's going to give them some reasonable idea, and then they can either bring that into their primary doctor and say, "Hey, this AI interface suggested this might be psoriasis. What do you think?" And, it might guide them in a way that overall will be helpful. And there's going to be pitfalls or, scenarios where, yeah, they overuse it or they use it in excessive ways. So that's true of the internet right now, right? I mean, I tell
Yeah.
parents, what not to Google, or if you Google this, you're going to see the
Right.
worst case scenario. So it's just a matter of like putting the guardrails on.
Did it
Yeah.
have a disclaimer at the bottom of that response, Josh? Did it
Well, I
tell you
think
to seek
ChatGPT
medical?
always has a disclaimer. It says, ChatGPT
Not
can make
a
mistakes, check important info. That's all it says, right?
Oh,
So
it doesn't
it's
specifically
always,
say please consult with an actual medical doctor.
it did say that, no, it did not say that actually.
Yeah.
Sorry. There did not say to go see a doctor.
Feedback
It didn't
to
say it
Uh-oh.
wasn't a doctor
ChatGPT.
either. Um,
OpenAI, take care of that.
But I think this is like, this is the common stuff, right? I mean,
Mhm.
we talk about Chat GPT and getting information from the internet, right? You used to have to Google it. Before Google, you go to a library, right? A medical
Mhm.
library. And then you went to Google, and now you're going to a Chat GPT, which you don't really know what it's trained on. I mean, some of the models let you know where it's getting its information from. So there is kind of this level of trust that I don't think is fully there yet for everyone, right? So
Well, yeah, I think that can be mitigated if we use certain interfaces. Like, so if AI can tap into only PubMed
Mhm.
vetted
mm,
journals, or you say, I
Mhm.
want you to only access these atlases to generate your information, or these, gold standard recommendations. If we can limit the library of data, then it may not have some crazy hallucinations. You could
Mhm.
potentially limit it. And even from like the provider standpoint, if you're trying to teach medical students and you give them an AI interface that really will only pull from the textbooks that we would normally use, then they're going to be in a safer environment. It's going to be a less
Right.
ridiculousness, for lack of
So
a
so don't treat your acne with wind chimes and incense.
yeah.
Windex,
Not yet.
Windex.
We'll find out. Maybe one day.
So earlier in the podcast, you shared that you see an opportunity for AI to augment every stage of that medical journey or that pipeline. Do you see it, just kind of thinking into the future of, healthcare, future of dermatology, do you see there being a world in 5, 10 years where you're get it, you're just interacting with a screen that's, or because I've always seen the value in having human beings, and I know that there's certain scenarios where it's very great to have a human being. There's also just, certain things that you want to have somebody able to provide empathy or support, or you don't want to just be hearing certain news from a screen.
Right.
How do you see the evolution of this, and maybe it's the case where, a simple or something, there's a screening, and if it's something very light or moderate or whatever, and it can be treated by just maybe a screen, and it's a very quick interaction, maybe that's a world. And then there's more serious things where it's humans. Do you see it always needing a human? Or I guess, what do you see, projecting a handful of years into the future, like
Yeah.
what that world looks like? And also kind of how we can, a lot of people have the doom and gloom of AI, right? And so what is the, what steps do we need to take in order to make sure we have a more, I don't want to call it utopic, but a more positive path towards, the future that you're going to describe?
Yeah, no, that's a good question. I would have to say if a patient or parent with their child makes an appointment to see me, they're never going to be satisfied with coming in, being shunted towards the AI only hallway, and then going out. I mean,
Very
even if
true.
they have zero copay and it was free, they're going to feel like they
Yeah.
were dismissed. So at the very least, they're going to have a 2-minute encounter where they said, "Did everything make sense? Do you have any questions?"
Hmm.
But that could be potentially done by a physician assistant, and we can shunt people safely towards people who maybe had less training, and that would be sufficient for the lower risk conditions. It may allow me to see the more complicated patients who need the 25-minute appointments.
Hmm.
That's one of the things that we struggle with, right? Is once in a while we have a patient with like full body psoriasis who has the same 15-minute time slot as the
Hmm.
patient with one spot that I say you're good to go. So
Right.
this, I think, will allow for patients who need my time to get my time, and the ones who really need a few minutes of maybe an assistant of mine reassuring them, they'll be more appropriately treated and triaged. But to your point about like everyone who's coming in to see me, and how to utilize AI to make the experience better, I think right now one of the things a lot of doctors struggle with is the competition between the digital interface and the patient. So
Hmm.
they're doctoring and documenting, and they're going back and forth between the two. Right now in my practice, I don't do that because I have a physical scribe,
Right.
but ambient scribes, which are, you train them once and they just get smarter and smarter. They're
Mhm.
going to definitely be the way that we're going to probably practice for cheaper and faster and better. I mean, we love the scribes. They're nice people, but they'll have a accuracy rate that's probably on par with these ambient scribes, and then they leave for another job. And now we have to retrain
Right.
a new scribe. So
Yeah.
we're going to have the ability to minimize burnout and have less conflict between the doctoring and the documentation. And that's a better patient encounter. And
Yeah.
with the help of AI. So I have to tell you too, the physical drain when you're in a like computer screen all day long
Oh yeah.
is very real. And so when I'm doctoring and talking to the patients and very minimally on my device, I leave the day less exhausted.
It's interesting in that to Nick's point and a bit of yours is, you're dealing with obviously pediatric, so you're dealing with young, and it's probably true, especially with older men, is the hesitancy to see the doctor, or that fear factor, the white coat effect of being scared to go to the doctor's office. So I feel like AI has the potential to, especially in a younger generation that's used to being on screens, and many who went to school through the COVID shutdown for quite a while. Do you see that there's any hesitancy, or do you think that AI might give that openness to people who are hesitant to go to the doctor?
Yeah, and actually acne is a great use case for that, right? So I mean, there's plenty of TikTok 12-year-olds who want to come into derm because it's trendy. There's also like the 15-year-olds with a face full of acne who don't want to leave their house at all. And they
Right.
certainly don't want to go to an office and talk about their acne. This is like a nightmare scenario for them. So
Yeah.
if they could interact with an AI bot who's very good at giving acne advice, they are thrilled to, do that for a month, clear up some of their acne, and then maybe if needed, they'll see someone if it's more severe. But yeah, that hesitancy is real in the teenage population. The younger kids certainly can be fearful that they're going to get a shot and et cetera. So they would probably rather be reassured at home that it's nothing severe, if the parents are satisfied with that. There's plenty of conditions or I'm going to need to see them and do a procedure on them. And it is what it is still. There's no robot for that yet. So, but yeah, I think we're trying to distill out the cases that are perfect for this and the ones that aren't. And that's going to be something we'll learn along the way.
Yeah, I think that's a good point because, that person who's afraid to leave their home is probably on TikTok and, interacting with the Snapchat AI, and they might be actually getting some advice from those things of maybe it's correct, maybe it's incorrect, but they're not going to know, right, until someone who's certified said, yes, this is right or this is wrong. So having, exactly as you said, Dr. McMahon, something that is trained on very specific atlases and publications and being able to say, hey, this is where it's referenced, or this is severe, go to a doctor, this is what I recommend. I think that's where we need to get to, at least in this first phase. But we're talking about AI, we're talking about utopic futures. I think, we've all seen the movies where, the robots kind of run the world and you walk into a full body scanner and it knows everything you need and what vitamins you should be taking and all that kind of stuff. And then even to the next level of where robots are performing surgeries. I mean, that's happening today, if I'm not mistaken. I just read an article recently where it had like a 95% success rate on secondary heart, surgeries, cardiovascular surgeries performed by a robot, right? This was a machine that was performing these surgeries, doing from the incision all the way to closing up the patient. I mean, how does that make you feel as a doctor who went through years of training, or what kind of effect does that have on kids today who want to become doctors and the future of
Yeah.
doctors?
Yeah, I mean the robotic surgery is still to me seems like I don't know if I would feel comfortable yet being that patient, but I know it's happening and maybe in some ways there's precision that a human's never going to have, right? With suturing and
Mhm.
I don't know if I'm personally there yet, but I know it's happening. I mean, if that's happening and there's good success rates, then why wouldn't you be able to freeze a wart with a robot? You know what I mean? It's
Right.
like very low risk. So so yeah, I wouldn't be offended if that started happening. There's plenty of other things for me to do. And to your point about, the softer side of medicine and giving news and helping them through, their hair falling out and being the person who picks up on emotional, issues, those are still going to be things that we're going to need humans for. But yeah, I mean, if there are ways for us to enhance both the physical and kind of intellectual parts of medicine, and the rest of it we can lean into and do a better job as humans, great.
I've done the robotic part, but it was mostly just like an injection, like a cortisone shot, where it's done by a machine. It's not necessarily done by a doctor. The doctor says, hey, this is your target machine, and the machine goes, scans over you, and injects you where you need to be injected. And, to me, that's a great use case. I never went through training as a doctor or as a surgeon. And to me, that would seem like it's kind of encroaching upon my
Yeah.
skill set as, a physician or a surgeon. And
Yeah.
it seems to be that kind of gray area of, how does the surgeon feel about all these robots coming into the workplace?
Yeah, and radiologists, right, is the other huge part.
Yeah.
Yeah.
Pathologists and radiologists. I think there is some humility occurring already in that world, where like if the robot or AI is better at counting up, numbers on a screen of a pattern, or it's better at picking up a tiny little speck that we would have missed, and it's the beginning of a brain tumor, we have to acknowledge that that's going to be better for the patient, right? And then focus on something else that's within our field. But yeah, I mean, like giving shots is something right now that is scary. If there could be a way to put a 2-year-old into a little game that's, the car that they're driving, and there's a cool pack that's
Yeah.
distracting their skin and it gives them the shot and they barely felt it. Like, who wouldn't want that for their kid if it's the same
Right.
outcome ultimately medically? So I think the biggest concern, if I got to be a little bit like worried about it, would be if we leaned into this a little too much and didn't verify. So,
Yeah.
prescriptions were being written, like the calculation of a medicine for a 1.5-year-old who weighs this much is going to be done very well, I'm sure, by computers, except when it's not. And then if it's your kid that got overdosed because of the fact that that was the recommended dose and no one checked it and it got through the prescription was signed by someone and then delivered by a pharmacist and given, that those are the things we just have to have like really strict parameters on. I mean, all of this we do have to have, oversight, but it's
Yeah.
exciting.
All right. So, Doc, if we were to give you a magic wand and say, hey, this magic wand could do anything with technology and dermatology, what would that magic wand do for you?
Ooh, good question. I would like, especially given what we spoke about today, I would like the correct patients to come in to see me for the correct amount of time and allow me to doctor in a way that's enjoyable to me and the patient, have everything documented accurately, and have their experience be very smooth. That would feel delightful for me, and I'd feel like I was delivering care to the best of my abilities and still having a human touch, just with the enhancement of the artificial intelligence.
Well, it was great to have you, Dr. McMahon. Thank you for joining us. I think this was a lot of fun and we learned a lot from you, and the future of medicine and how AI can really help healthcare and help patients, I think is the ultimate goal for all of us.